Hi, welcome to New Start Now. I'm Don McIntosh, and today we're going to be talking about heart disease. And joining us is Brian Schwartz. And Dr. Schwartz, you're a cardiologist.
That's right.
You talk about this every day to all kinds of people, and we're glad you're with us here at New Start Now.
Well, thank you.
Heart disease, you and I have been talking, it's like a major killer in America. It's like #1, and it's being transported around the world. And, there's risk factors that are involved like smoking, diabetes, cholesterol, high cholesterol, hypertension, obesity, different things like that. But what can we do to avoid this? What kind of lifestyle things can we be involved in that can help us avoid it?
Well, in addition to obviously not smoking, probably the biggest risk factor that's on the rise in America, and it's actually becoming a public health epidemic, is obesity. And if we could control obesity, that would have a direct effect on the 3 other major risk factors: hypertension, hypercholesterolemia, and diabetes.
So if we're not overweight, we're not going to have high blood pressure usually, and we're not going to have a high cholesterol, and we're probably not going to be at risk for diabetes, is what you just said.
Gaining weight and being sedentary is probably the biggest risk factor for each of those diseases. There could be other causes, but they're much rarer.
So what do you tell your patients in terms of addressing this increase in obesity?
Well, first of all, I tell my patients that I won't ask them to do anything I don't do myself. And at that point, they breathe a big sigh of relief. And then I tell them that, well, I am a vegetarian, I don't smoke, and I exercise at least 4 times a week, usually running 4 to 5 miles a day. At that time, they're about ready to pass out.
So you first of all, you live what you preach, but do you help them? What if they say, "Oh no, how am I ever going to do that?" What do you tell them?
For someone who has lived their whole life eating at McDonald's and not exercising a bit, it seems like a very daunting challenge to make these changes. So I don't ask them to do all these things all at once. I ask them to start putting into effect steps that they can take. It might be just as simple as cutting out fried foods and red meats. I will ask them to just start walking. It doesn't even have to be fast. They don't need to go out and run like I do. Walking is one of the best exercises for the heart. In as little as 20 minutes, 3 times a week, has a benefit to the heart and can lower your risk for heart disease.
So the fried foods, back to the fried foods, that's because of the high fat. But what about the red meat? Why did you mention that?
Yeah, actually, animal products in general, including dairy, eggs, and meat products, are higher in saturated fat. Saturated fat is the fat that's particularly responsible for raising the LDL, which is the bad cholesterol that leads directly to plaque in the heart.
Okay.
And other arteries.
So your recommendation is just simply walking. That's what we do also here at the New Start program. We have shirts that say walk, walk, walk. We have people walk all over the place.
Anybody can walk. It doesn't take a gym membership or expensive exercise equipment.
And then what else? What else should we do? Any other guidelines to get us off the list here for heart disease?
Well, the whole American lifestyle is so pressured. Everybody feels like they're under more stress than they can handle. In today's economic environment, that's become a particular problem. But just having a support group, a church, or faith in God can be an important avenue for dealing with that. Just spending time relaxing with family, with friends, and taking time to relax might have a big benefit.
So that's something you do as well. You wouldn't recommend it unless you do it. Do you do those things?
I very much try to do that, yes.
And have you seen within your patients, I mean, you probably see hundreds of patients, a year. Have you seen a difference between those that have a faith versus those that?
Absolutely. It can be very dramatic. Not just for the support and the ability to relax during the day and kind of take your interest off all the busy things that you have to do, but it also helps give you a motivating power to make these changes in your life.
And an accountability group. People see you, want to know how you're doing.
Absolutely.
What's happening. Well, so basically then, just to summarize, exercise, you've mentioned. Walking is basically a thing. If someone can't walk, what do they do then? What do you tell them?
Any type of exercise would be okay. If they could ride a bicycle, an elliptical machine, swimming, all those, any type of aerobic exercise, 20 minutes, 3 times a week at a minimum, has a benefit to the heart.
So exercise, diet, and then having those social relationships and trust in God.
Absolutely.
We're glad you've joined us today for New Start Now. You can get more information at our website, newstart.com. And we're glad you've been with us, Dr. Schwartz. Thank you for taking time out of your busy schedule.
You're welcome.
And if you need a place to go, come to New Start. We can help you with all the things the doctor just mentioned. and thanks for joining us. We hope that you have a new start right now.